So one of the tests that we often recommend in the Syncope clinic after we've done our basic workup is something called an implantable loop recorder, or ILR, or sometimes they're called a reveal device or a link device. What is that?
So I happen to have one as a prop now, and a link device is this size. So if I put my pinky here for you to have a look and appreciate the thickness of this device and the size of this device, this is a small device that has a battery and an automatic sensor that senses every single heartbeat, and it's implanted on the inside of your chest wall, just underneath the left side of your breastbone. So I'm going to show you where typically the implant might sit, just there.
So over your heart?
So it's over your heart, and in women, slightly over the breast. We don't want this to be sitting in your breast tissue, but sitting above your breast tissue, about there. Sometimes we implant it more horizontally, like this.
And what does it do?
So this has the ability to have sensing of every single heartbeat in a very precise way, but also continuous way. So it senses and detects automatically through an algorithm, which means that it has a live detection of your heartbeat. And that means that when you power this with a bedside link device home monitoring kit, and in the latest devices you can even connect it through your phone, you are able to then transmit this data live to a central control hub, which is typically your pacing clinic at the local hospital, who will be able to see what's happening in your heart at the time.
So it's a way for your team to know what your heart is doing on a beat-by-beat basis. Why might someone need one of these?
So typically this is implanted for...
sometimes the trigger, sometimes if they faint, they've got a little trigger.
Sorry, who's doing this interview?
Oh, sorry. I wasn't sure.
Oh.
I forgot the little trigger.
Oh, no.
Why might someone need one of these?
So typically reveal devices or link devices are implanted to investigate a cause of syncope. And if you are the kind of patient who has a very, very infrequent episode of fainting, for example, which might occur once every 3 to 6 months, then we can do many 24-hour Holter recordings on you and never see anything. So to increase the diagnostic yield, we normally would implant something like this, which has a 3-year battery life.
So this is when we suspect that there's a problem with the ECG, so something wrong with the heartbeat, but it happens very infrequently.
Correct.
So say every 6 months, we would then look at it and say there's a problem with the heartbeat over the time of the collapse, and therefore we could correlate the two. Is that right?
Exactly right. So we'd want to know whether at the time of your next collapse, which is infrequent, whether you have a heart rhythm abnormality to explain that collapse.
So not all syncope patients will need one of these. If we think that the patient has a clear vasovagal syncope, for example, with a low blood pressure, then this won't be helpful. This is for the people where we think there's a problem with the ECG, the heart rhythm, sorry.
Exactly right. So we make a distinction between vasovagal syncope and cardiogenic or cardiac syncope. And the link device is only relevant for the patients in whom we haven't been able to make a clear diagnosis of vasovagal syncope, and we wonder whether or not they have cardiac syncope, but it's so infrequent that we can't pick it up on a regular short-term Holter device.
And sometimes a similar situation if a patient is having a convulsion or a seizure, and we're not sure whether that's coming from a problem with the heartbeat or an epileptic seizure, that can also be useful at times.
Yes, it can. It hasn't made it directly to a neurology standard diagnostic test. But if a neurologist is concerned that the seizure that the patient is experiencing is actually not a seizure, but a particular form of seizure, which is called convulsive syncope, and this is where I need to slow down and explain. Convulsive syncope is when you have a convulsion or seizure-like activity. So for the bystander looking at somebody with convulsive syncope, they would not be able to distinguish that from generalized epilepsy, tonic-clonic seizures. But the difference is somebody with convulsive syncope has a secondary seizure in the brain because the brain hasn't been perfused with a cardiac output, i.e. the heart has stopped for 10, 15, 20 seconds. And as a result of hypoxia or lack of oxygen to the brain fires off in an epileptic seizure, not epileptic, but a convulsive syncope. And when that happens, neurologists can misdiagnose, or it's not a misdiagnosis. The diagnosis is unclear. Yeah. So they start patients on anti-epileptic medications and find typically that it doesn't work.
Is this a big procedure?
No, it's considered a minor operation that's done under local anesthesia, typically taken out of the cath lab environment into a link procedure room. At Imperial, where we work, we've trained cath lab nurses to implant this very easily with a very high success rate and low infection rate. It's done in about 5 to 7 minutes. The whole implant procedure takes that length of time, and it starts off with a local anesthetic injection here and an injectable device. So this device is so small as to fit within a special introducer syringe that is simply injected and plunged into the column that is made with a local anesthetic tract.
Amazing.
And then when we pull out the plunger, we press to stop the bleeding, and after 3 minutes we put some steri strips and a sterile dressing, press for a further 5 minutes, and you're out of the link room.
And how long does it stay in for?
It has a battery life of between 3 and 4 years, depending on the generation of link that you're getting. And the implantable loop recorder nowadays has, with the latest iteration, 4 years of battery life, but it doesn't mean it needs to stay in for 4 years. So for example, if you've had this just for 3 months and you have had an episode where you faint and the link clearly shows that you have a 20-second pause, you might then be invited back to have a pacemaker, and that will solve the problem. So the link, to be clear, is not a therapeutic device. It doesn't do anything to stop your faint. It just records what is going on. You still need therapy.
Okay. And what happens after 4 years?
After 4 years, the battery expires. Your pacing team will typically invite you back to have this removed, or invite you to decide whether or not you should have a fresh implant or have it removed. My view, which is not universal, but depending on a case-by-case basis, is that if you haven't had any clear repeated events for 4 years, you're probably going to be okay.
So once it's gone in, the patient's gone home, what do they do then? What happens to them?
So there are 2 ways in which the link is used. It's important for you to know as a patient that the link itself is a smart device. It's meant to be smart. It's got an algorithm to detect within predetermined settings for any spontaneous episodes of a slow heartbeat, of a tachycardia, which is something like atrial fibrillation, ventricular tachycardia, atrial tachycardia, which are all fast heart rhythm problems. And you don't really have to do anything. You sleep every night in the bed, and the home device that is plugged by your bedside or on your mobile phone will transmit these episodes of bradycardia or tachycardia. And for example, if the question is, if I'm asleep and something happens, say my heart stops, but I don't know that my heart's stopping, will I ever see it? And the answer is yes, because the device has a beat-to-beat detection and alarm systems which will trigger a pause of greater than, let's say, 3 or 6 seconds, depending on what we set it as. The second way that you can use it is also quite important, is that we will give you a little activator, a wand which is about that high, about 3 inches long, that you can carry with you. And if you feel dizzy or if you have a faint, you can take the wand, put it on your device, and you can press the button to make a recording. And what it will do is it will snapshot and take a 8-minute segment of recording or 5-minute segment of recording backwards from where you took the snapshot. And for example, if you felt unwell and dizzy, but the link recorder did not record any tachycardia or bradycardia, and you took a snapshot, we will still be able to see that data, although the automated signal isn't processing that for a triggered event.
Yeah.
And we will be able to tell you that actually this particular episode of dizziness that you had, that you triggered on the wand, does not correlate to any abnormalities with your heart rhythm. So this can be useful, for example, in patients with epilepsy. So patients with a neurological seizure condition who have seizures, who then trigger the link device, will see that actually throughout the seizure there was no brady or tachycardia.
No problem with the heart rate
no,
or rhythm.
No problem with the heart rate or rhythm to account for why they had the seizure or loss of consciousness, which means the diagnosis is not cardiac syncope, but it's more likely a neurological diagnosis.
Or, of course, maybe a problem with the blood pressure or another cause of collapse that's not related to the heart rate.
Exactly.
So it's a very helpful device. Thank you.
You're welcome.